Greetings Africa and hello to our audience around the world. Welcome to our COVID-19 Response Fund virtual fundraiser. I'm Henry Bonsu and I'm your host for today's historic event. Today we're asking you to join a fight against our common enemy COVID-19, which has devastated lives and livelihoods around the world. Our continent has not been spared by the virus despite rapid and decisive action. It's taken a heavy toll and the situation is on a knife edge. We've seen throughout the crisis that we're stronger together, and that's what today is all about. To fully appreciate the work that's taking place and why it's important to have a collective approach to this disease. The African Union, the Africa Centres for Disease Control and Prevention, and Afreximbank have organised the AU COVID-19 Fund to implement a continental joint strategy. The fund was established by His Excellency Mr. Moussa Faki Mahamat, AU Commission Chairperson, who's one of our guests today. He aims to strengthen the continental response to COVID-19 by, for example, supporting pool procurement of diagnostics by Africa CDC for distribution to the member states and mitigating the pandemic's socio-economic and humanitarian impact on fellow Africans. Today's virtual fundraiser is a chance for all of us to support our institutions. All organisations and individuals can contribute to the fund, and we invite you all to make donations. No amount is too small. Every contribution can make a difference. So today we'll hear from our continent's political leaders, captains of industry, frontline healthcare workers, and our talented artists on what they've done and what they will continue to do to make sure that Africa responds effectively to this crisis. Only together will we be able to prevail. Ladies and gentlemen, without further ado, I would like to introduce His Excellency Cyril Ramaphosa, Chairperson of the AU and President of the Republic of South Africa.
Chairperson of the African Union Commission, His Excellency Moussa Faki Mahamat, Director General of the World Health Organization, Dr. Tedros Ghebreyesus, Director of the Africa Centre for Disease Control and Prevention, Dr. John Kengasong, members of the Board of Trustees of the AU COVID-19 Response Fund, our friends and partners in the international donor and business community, ladies and gentlemen, it is indeed my privilege and my honor to offer a message of support to this event, an event which is being held for the most worthy and important of causes. It is now 8 months since the first reported case of coronavirus on our beloved African continent. Since then, the pandemic has swept across our continent, leaving devastation in its wake. To date, there are over 1 million people infected with the virus in Africa and close on to 28,000 people who have lost their lives. Beyond the human tragedy of the lives that we have lost, COVID-19 has had a dramatic impact on the various national economies on our continent. As African nations, we have come together in ways rarely seen before. What we are most proud of is the AU COVID-19 Response Fund, which we established in April this year to mitigate the social, economic, and humanitarian impact of the pandemic across the continent. It is a financial instrument to mobilize and manage funds from the private sector and other stakeholders. Its resources are being directed to priority programs and interventions like purchasing medical supplies, conducting public awareness campaigns, and interventions to support livelihoods in distressed countries. The fund is also supporting the Africa Centre for Disease Control and Prevention, Africa CDC, which is playing such a key role in our continental response. This fund best encapsulates Africa's quest for self-reliance and our desire to be architects of our own destiny. With African countries and companies being the first to contribute to the fund, we demonstrated clearly that we as Africans are taking the lead in the role of combating this great tragedy that has befallen our continent. That said, we cannot realize the great potential of the fund to bring this crisis to an end without much needed support. So far, we have managed to raise $44 million in support of the work of the fund. However, we need to raise at least a further $300 million to ensure assistance is provided to societies and countries in need, and to enable us to weather the health and economic storm in the weeks and months and years ahead. For us to continue with the prevention efforts and healthcare and case management for our people, the fund has to mobilize additional resources as quickly as possible. Once a COVID-19 vaccine becomes available, we will also need substantial resources to ensure equitable access for all African countries. We're extremely heartened by the wide representation from all sectors at this fundraising event. I want to thank all who are in attendance, who have lent their public profiles, their voices, their expertise, and their influence to supporting this cause. We could not have come this far without your help. I call on both our first-time donors and those who have pledged their support previously to give generously to this fund. In doing so, you are not just making a contribution to overcoming this current emergency, you are also making a solid investment in Africa's recovery in her future. I thank you.
My name is Bethlehem Zebabu. I am AP analyst in Africa CDC. While Africa has put up a strong front, the war is by no means won, and it will require collective concerted effort and deliberate and coordinated action. To achieve this, we call on all Africans to support the African Union fight against COVID-19 by donating the African Union COVID-19 Response Fund. Join us, and together, let us fight against COVID-19 in Africa.
Ben Paul.
From my point of view, my concerns around the prevailing COVID-19 crisis is that it's been devastating in the entertainment industry, particularly for concerts. In normal times, I would have been on tour in and out of Tanzania. And through these tours, we create job opportunities for so many people. My team, together with the employees, hotels, and all our salespeople and vendors, all have been forced out of work because we have to manage and curb the COVID-19 pandemic. We thank the African Union for its COVID-19 Response Fund and for being a very important vehicle, especially with its active responsibility during this time when COVID-19 is everywhere. We ask our viewers to get involved actively by supporting, sharing information, as well as donating to the African Union COVID-19 Response Fund. Together, Africa is responding.
Thank you, Your Excellency President Ramaphosa, for your words and for the remarkable leadership and all the efforts to combat COVID-19 across the continent. And thank you to our sister Bethlehem from Africa CDC. I think one of the things that this crisis has proven to us is the importance of healthcare workers who are on the front line of this pandemic. I've got to say too, Ben Paul, we can't wait to attend your concerts in Tanzania.
I must first commend our various governments across the continent for moving swiftly to mitigate the impact of COVID-19 on our populations. Despite these efforts, however, we lost some loved ones to COVID-19. May their souls rest in peace. Committed to the continent, we provided support of about $3 million in various forms across our footprint of 33 countries, while also working closely with the African Union to specifically focus on some areas of vulnerability on the continent. EcoBank will continue to leverage these platforms and resources for health and social development. Support for the African COVID-19 Response Fund is an opportunity to demonstrate unity and solidarity for Africa. Getting to the Africa we want together means building back better. I therefore encourage the private sector in the continent to join this effort to pool resources together and make the Africa CDC a premier Pan-African disease control agency safeguarding the health of Africans. Thank you.
Life as we know it has completely changed. The way we work, the way we live, our relationships has completely changed. In my lifetime, I would say this is the hardest I've ever been through. But if we stand together, if we help each other, I really think we can make this hard time easy for ourselves. So this is why I say we are proud to be standing in solidarity with the African continent. We should all stand together for the AU COVID-19 Response Fund, which is valuable to fight this pandemic. So I ask everyone who's watching this video to pledge, to share, to help for the AU COVID-19 pandemic.
We'd like to thank Mr. Ade Ayayemi, Group Chief Executive Officer, EcoBank, for their valuable contribution to the fund. Now let's hear from the Chairman of the Board of Trustees of the AU COVID-19 Response Fund, Professor Benedict Orama.
Your Excellency, President Cyril Ramaphosa, President of the Republic of South Africa and Chairperson of the African Union, Your Excellency, Mr. Musa Faki Mahamat, Chairperson of the African Union Commission, Your Excellency, Dr. Tedros Ghebreyesus, Director General of the World Health Organization, Your Excellencies, Honorable Ministers here present, Your Excellency, AU Commissioners here present, Your Excellency, Dr. John Nkengasong, Director of the African Center for Disease Control and Prevention, my colleagues, members of the Board of Trustees of the African Union COVID-19 Response Fund, captains of industry and bankers, distinguished guests, ladies and gentlemen. On behalf of the Board of Trustees of the African Union COVID-19 Response Fund, which I chair, it is an honor and privilege for me to address you, our valued partners, at this virtual event, which seeks to enlist your support in the continental fight against the COVID-19 pandemic. Since the declaration of the COVID-19 outbreak in December 2019, the disease has spread rapidly across the globe. With neither a vaccine available to prevent infection nor medication to cure the infection, the disease is likely to continue to spread and cause havoc. As I speak to you from the perspective of the continent of Africa, over 1.5 million people have been infected. About 35,000 people have died from this deadly disease. And not only have we suffered from death, disease, infection, the continent has also suffered economically. A continent that has over the years seen growth has now gone into recession. It is estimated that the continent will contract by about 3% this year. Trade has also declined in a large way. Our youth whom we depend, are all going out of job. Our tourism sector, our manufacturing sector, our services sector are all negatively impacted. The African Union have not sat on its palms while all these tragedies unfolded. In April, the COVID-19 strategy was unveiled by the African Union. The joint continental strategy was unveiled and intended to map out the collective action of the continent towards combating the disease. It is in the context of that strategy that the African Union COVID-19 Response Fund was created. And the fund was charged with the mandate of working with Africa CDC to support the continent in dealing with the health impact and also the socioeconomic and humanitarian impact of the disease. Since then, a lot has happened. The Africa CDC has been doing a fantastic job mobilizing first responders, helping to distribute millions of test kits, helping to distribute millions of therapeutics that are available all across the continent. The African Union COVID-19 Response Fund has supported this effort, providing funding for the logistics needed to implement the distribution of some of these supplies, providing funding that has made it possible for the first responders to be moved around the continent. Working with the Africa CDC, the Africa COVID-19 Response Fund has also participated in supporting the creation of the African Medical Supplies Platform, a platform that has enabled the pooling of the procurement of COVID-19 commodities and supplies in the continent, helping to reduce the cost and to make it easier for the smallest and the biggest countries to get COVID-19 supplies at affordable prices. And even beyond that, the fund has also negotiated with the African Export-Import Bank, which has made it possible for the bank to provide overdraft facilities that has facilitated the procurement of COVID-19 materials from countries that need the liquidity to support those procurements at these difficult times. The COVID Response Fund working with the Africa CDC have even done more. But these are not enough. We know that until a vaccine that is efficacious and safe is out, this disease will continue to cause damage in our continent, destroy our economies, kill our people. That is why we need the support of everybody. We need to continue to prevent the spread of the disease by procuring the preventive materials, the personal protective equipment, test kits, the therapeutics that are needed to contain the disease. We need to be prepared to ensure that the vaccine, whenever they are available, are distributed all across the continent effectively. We need to make sure that whatever vaccines are available are those vaccines that have been tried in our continent. So we need to support the trials that are currently going on in different parts of the world, but only going on in South Africa. We need to make sure that vaccine trials are conducted across Africa. All these we need money. All these we need funds. Since the creation of the COVID-19 Response Fund and the call for action to mobilize funds to support the Africa CDC and the COVID Response Fund, we've raised collectively slightly over $100 million. But only about $60 million have been received in the bank account. But the plan under the AU strategy for COVID-19 is to raise about $650 million to support the work of the Africa CDC and support all aspects of the collective effort that the continent needs to put in place. That is why we've organized this event. That's why we're calling on all of you to rise to the challenge, because a COVID-free Africa is good for all of us. A COVID-free Africa will be a continent that will return to the growth path we've seen in the past few decades. Without containing the disease, the continent will go into reverse. We cannot sit on our palms and see a continent go into reverse. We can do something about it. I know you can do something about it. I know that you all believe in the future of the continent. You all believe in the future of our youth. So we have to rise today to make our own small contribution. There is nothing, no contribution that is too small. And I must thank each and every one of you who have already made the contributions. The corporations, the banks, the individuals who have made contributions, we thank you. Those who have not made the contributions, we call on you to go now to your banks and please join us. We thank the donors that have supported the continent, sending in drugs, sending in test kits. We thank the governments all across Africa and beyond, from Europe and from Asia, who have also made donations to the fund. We call on all those who have not done so to please join our fight, because Africa needs your support. Let me close by thanking all those who have helped us today. Let me thank His Excellency President Cyril Ramaphosa for standing behind the effort to combat COVID-19 in the continent. I would like to thank, on behalf of my colleagues at the Trust Fund, His Excellency the Chairman Musa Faki Mahamat, for supporting the fund, making sure that it gets all the support that is required at the AU. I would like to thank all those donors, the foundations that have supported us, and call on them to continue to support us. I would also like to thank IC Communications, who helped to put this event together. I thank One Campaign for also supporting this event, making sure we have all the support, all the creatives that we are going to be watching later as the ceremony unfolds. Thank you very much for joining us today. We hope that after this virtual event, you will retire and make the donations we seek. You will retire to also contribute to the future of the continent of Africa. I thank you.
Good afternoon, ladies and gentlemen. My name is Junior Ngulube, Vice Chairman for Sanlam Pan-Africa. As a Pan-African organization that prioritizes doing well by doing good, Sanlam is dedicated to making a meaningful contribution towards fighting the pandemic and fostering the long-term sustainability of all Africans across the continent. We have always put our people, our clients, and the countries in which we operate first. Sanlam Pan-Africa operates in 32 countries across the continent. Therefore, together with our partners, the Mutsipe family and associated companies, we are proud to have been able to make a difference by donating 50 million rand towards mitigating the social, economic, and humanitarian impact of COVID-19 in all African countries through the African Union COVID-19 Response Fund. We fully support the initiative and objectives of this much-needed fund, since the COVID-19 pandemic threatens to reverse the socio-economic advancements made by Africa in the last 30 years. It was simply not an option for us to stand on the sidelines, as the opportunity to make a profound collective impact has never been greater. In addition, Sanlam Emerging Markets has thrown in its weight behind the fight against the spread of the coronavirus in all the markets that mirror its business footprint in Africa and other international markets where it operates. Sanlam has further donated 45 million rand to support various initiatives to fight the pandemic in Africa and other territories where Sanlam Emerging Markets has a business presence. Periods of extreme uncertainty like this call for all of us to come together, and we believe resilience stems from coordinated action. As a business sector, we are in a powerful position to make a significant, tangible financial contribution to fight through the pandemic and ultimately rebuild our economies, our lives. No one entity can confront the impact of the crisis alone. It is only through a collective, coordinated effort that we can start to really make a difference where it is needed the most. Therefore, we continue to call for all our sectors of society to form strong partnerships during this period. I would also like to take this opportunity to thank and applaud the Board of Trustees of the Fund for the swift action they have taken to mobilize resources as quickly as possible and for facilitating this well-choreographed event today. Finally, at Sanlam, we will continue to actively investigate opportunities to contribute towards supporting existing activities and initiating new ones to alleviate the impact and spread of this virus and the consequent COVID-19 disease on our clients, our staff, and across the African continent. We call on all our partners to do the same. Together we are stronger. Thank you very much.
We at the African continent have big losses like the rest of the world. The losses are not only jobs, but beloved people. We have to put our hands together, brothers and sisters in the continent. I'm very glad with CIB contribution to the COVID-19 fund that's sponsored by the African Union. We hope for a speedy recovery out of this pandemic. However, our contribution as CIB to the COVID-19 Response Fund is something that not only is an obligation, but something that we feel proud of. Standing by our sisters and brothers in the continent is a mandatory thing. Let's cross our fingers and look forward to get out of this crisis. Together we can make a difference and support each other to get out of this crisis. My name is Hisham Az Al-Arab, the Chairman and Managing Director of Commercial International Bank Egypt, CIB.
Professor Orama, Chairman of the Board of Trustees, AU COVID-19 Response Fund, thank you for explaining the role of the fund, the work of Africa CDC and of Afreximbank. Indeed, everyone's contribution is important, and I invite you all to visit the link you see on the screen for more information on how to make a contribution. Thanks as well to Mr. Junior Ngulube, Vice Chairman of Sanlam Pan-Africa, and to Mr. Hisham Ez Al-Arab, Chairman and Managing Director, Commercial International Bank from Egypt, for their valuable contributions. Now, ladies and gentlemen, let us welcome Her Excellency Dr. Hala Zaid, Minister of Health and Population, Arab Republic of Egypt, and also Chairperson of the African Union's Specialized Technical Committee on Health.
Your Excellency, Mr. Cyril Ramaphosa, Chairperson of the African Union, Your Excellency, Commissioner Musa Faqih Mohammed, Chairperson of the African Union Commission, Your Excellency, my brother, Dr. Tedros Adhanom, Director General of the World Health Organization, Your Excellency, my sister, Commissioner Amira Al-Fadil, esteemed board member, distinguished guests. It gives me great pleasure to join you today and participate in the virtual fundraising event for the African Union COVID-19 Response Fund, aiming to minimize and contain the social, economic, and humanitarian impact of the COVID-19 pandemic in all African countries by supporting the availability of essential medical equipment and supplies and mobilize rapid response by member states. Allow me at first to congratulate and express my sincere appreciation to the African Union Commission for their sustained assistance to member states and the tremendous efforts to mitigate the socio-economic and humanitarian impacts arising from this pandemic. With nearly 1.5 million cases and about 36,000 deaths across the continent, and with new Ebola outbreak, we as a continent must continue to effectively mobilize resources as quickly as possible for this fund, which acts as a vehicle for the implementation of the African Union COVID-19 continental strategy. What is required of us today is a new era of accountability. We have duties towards ourselves, our people, and our continent. We can only solve the challenges of our time collectively. We must do everything we can to make sure that our continent lives up to children's expectations. Simply, there can be no just Africa without reaching every individual in the continent with healthcare coverage, especially during troubling times like these. I would like to take this opportunity to emphasize the great importance of the continuous and fruitful collaboration across the continent amongst the African nations, and continuing to build on strong partnerships with international organizations, NGOs, stakeholders, global funders, and pharmaceutical industry. As a chairperson of the African Union's Specialized Technical Committee on Health, Population and Drug Control, and as member of the Board of Trustees of the Fund, and the Coordinating Committee of AU's Continental Response to COVID-19, Egypt has engaged our diverse partners from across the globe to help secure vaccines for Africa. Our high-level collaboration has resulted in the launching of the promising of several phase 3 clinical trials here in Egypt with Sinovac and Sinopharm, thus setting an example in view of the fruitful South-South cooperation for the advancement of the humanity. With the pledge made by His Excellency President Abdel Fattah al-Sisi, Egypt has sent approximately $4 million worth of in-kind support to our African brothers and sisters across the continent, and currently finalizing procedures for the $2 million pledged to the Africa CDC. Egypt reaffirms the commitment to promote health security throughout our continent. We will work together hand in hand and inclusively on fulfilling the African Union 2063 Agenda and the UN 2030 Agenda, achieving healthy and well-nourished citizens and good health and well-being for all people. Indeed, Egypt continues to send medical convoys across Africa to continue the implementation of His Excellency President Sisi initiative to treat 1 million Africans from hepatitis C and B, even during the ongoing pandemic. We continue to send our medical teams and mobile clinics to support our continent to face disasters' impact on health system in many member states. In this context, I am proud to state Egypt is persistent in improving overall healthcare outcomes. We continue to send aircrafts carrying tens of tons of supplies and much needed medical equipment to brotherly African nations mostly affected by COVID-19. Finally, I would like to once again thank all of participants for their generous support and continued efforts to assist the African continent in defeating this pandemic. And to us Africans, we should not underestimate ourselves. I thank you.
Dear African brothers and sisters, this health crisis gripping the world has not left our own countries unscathed. If we're not careful, this COVID-19 pandemic, a threat that continues to gain ground, is set to take a heavy toll on Africa. The stakes are high, so it is imperative that we support our continent. With this in mind, I welcome the excellent initiative taken by the African Union CDC in organising this collaborative response to a common enemy. I appeal to our values of sharing and mutual aid, and I invite you to support this new surge of solidarity which will help bolster the COVID-19 Response Fund. These actions will go a considerable way to strengthening the resilience of our economies and governments. For my part, I solemnly pledge to support this fund to the tune of $500,000. This pledge is a follow-up to the $1.5 million of support offered directly to the people of Senegal to provide food and monetary assistance to those in need. I remain firmly convinced that if we act as one, making a concerted effort, we will succeed in ridding ourselves of this scourge and calmly addressing the question of our beloved continent's future, the fate of which is now in our hands. Let us all be united in victory against COVID-19.
But I feel like this moment was a teachable moment for all of us, and it showed us, even without us realizing that we had it before, how strong we were and how much we could survive. We had some hope, and we pushed, and we tried to make something happen, and we didn't let the moment dictate to us or say to us that we were failures, you know what I mean? So it's been crazy, but we're lucky to be alive, and we're happy to be here to tell the story. We are proud to be here today in solidarity with the African continent to endorse the African Union COVID-19 Response Fund. We encourage all of you watching us today to donate, share, and pledge to the AU COVID-19 Response Fund as a valuable tool for the continent to fight the virus. Together, Africa responds.
Thank you, Your Excellency Dr. Hala Zaid. Merci beaucoup, Monsieur Kadim Ba, Directeur Général de l'Ocafrique. My sister Adina Midase. And now we invite Dr. Tedros, Director General of the WHO, who will talk about the work his organization's been doing across the continent and around the world. Dr. Tedros.
Your Excellency President Cyril Ramaphosa, Your Excellency Chairperson Moussa Faki Mohammed, Excellencies, distinguished guests, dear colleagues and friends. Thank you for the opportunity of sharing a few reflections with you today. And I would like to thank Your Excellency President Ramaphosa and Your Excellency Chairperson Faki Mohammed for your leadership of the African Union during this unprecedented crisis. Regional solidarity is critical, and your efforts in developing the continental strategy and the coalition of business and political leaders have been very important. As you know, at the beginning of the pandemic, we were all deeply concerned about the potential impact of the virus on the African countries. But so far, most African countries have succeeded in preventing or suppressing widespread community transmission. However, all countries must remain vigilant, and there can be no place for complacency. The virus is still circulating, and most people remain susceptible. Since the earliest days of the pandemic, WHO has been working round the clock at all three levels to support our African member states in close partnership with the Africa CDC. I would like to use this opportunity to thank my brother, Dr. John Kengasong, for his leadership. All countries in Africa now have a preparedness and response plan in place. All countries on the continent now have lab testing capacity for COVID-19 compared with just 2 at the beginning of the pandemic. Over the past few months, WHO has shipped millions of test kits and tons of protective equipment to many countries in Africa. We have trained thousands of health workers, and through the Access to COVID-19 Tools Accelerator and the COVAX Global Vaccines Facility, we're working to ensure that if and when a vaccine is proven to be safe and effective, it will be accessible equitably for all countries. But we all know that the impact of the pandemic goes far beyond the suffering caused by the virus itself. Lives and livelihoods have been lost, and the pandemic threatens to undo the gains we have made in recent years towards health equity and the sustainable development goals. According to the World Bank, the region is now in its first recession for 25 years. And in June, the International Monetary Fund predicted that the sub-Saharan economy will contract by 3.2% this year. In that regard, we welcome the establishment of the EU COVID-19 Response Fund to boost the capacity of the Africa CDC and to address the socio-economic and humanitarian aspects of the pandemic. In July, WHO contributed $5 million to the African Union to support the Africa CDC to implement the joint continental strategy for COVID-19, and we're committed to working with you closely to further strengthen the Africa CDC. We also urge all African Union member states to ratify the Africa Medicines Agency, which will be a very important institution for the continent. Excellencies, dear colleagues and friends, COVID-19 has taken so much from us, but it has also reminded us that health is not a luxury item. It is the foundation of social, economic, and political stability. We're all in this together, and with national unity and global solidarity, we will overcome this pandemic together. Thank you. Merci beaucoup.
Je m'appelle Félix Ngabire. Je suis agent de santé publique à Africa CDC. Si l'Afrique a mis en place un front fort,
my name is Felix
la guerre
Ngabire.
n'étant en aucun
I am
cas
a public
terminée,
health agent at Africa
elle
CDC.
nécessitera un effort
While Africa has
collectif
put up
et
a strong
concerté
front, the
et
war
une
is by no
action
means over. It will
délibérée et
require a
coordonnée.
collective,
Pour
collaborative
y
effort and
parvenir, nous
calculated,
appelons tout le
coordinated
monde,
action.
surtout les
In
Africains,
order to achieve
à
this, we are
soutenir
calling
la
on
lutte de
everyone,
l'Union africaine
particularly
contre
Africans,
COVID-19
to support the
en
African
faisant
Union's
un
fight
don
against
au Fonds
COVID-19
d'intervention
by making a
COVID-19 de
donation
l'Union
to the
africaine.
COVID-19 Intervention Fund.
Rejoignez-nous
Join
et
us and
ensemble,
together we
luttons
can
contre
fight
COVID-19 en
COVID-19 in
Afrique.
Africa.
Je vous
Thank you.
remercie.
Hello everyone, my name is Terry Maganaki. COVID has affected us in numerous ways. I remember the first few months, I was indoors, I couldn't go out, I couldn't perform, I couldn't see my loved ones. We are proud to be here today in solidarity with the African continent to endorse the African Union COVID-19 Response Fund as a valuable tool for the continent to respond to the pandemic. We encourage all of you watching us today to donate, share, and pledge to the AU COVID-19 Response Fund. Together, Africa responds.
Thank you, Dr. Tedros. Indeed, solidarity is key to overcoming and beating this virus. Thanks again to our frontline workers and to our amazing artists. Now, Dr. John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention, would like to give us an overview of the COVID-19 situation in Africa and the different initiatives that the Africa CDC has launched to fight the pandemic. Ladies and gentlemen, please welcome Dr. Nkengasong.
Hello, I'm John Nkengasong, the Director of the Africa Centers for Disease Control and Prevention. Today, I would like to share a brief overview of the COVID-19 situation in Africa. On February 22nd, 2020, the African Union Commission and the Africa CDC convened an emergency meeting of all ministers of health of the AU member states to discuss and endorse the Africa Joint Continental Strategy for COVID-19, underpinned by coordination, cooperation, collaboration, and communication. Through this strategy, we have made great strides in our response to COVID-19, including the facilitation of trainings and capacity development of member states. The scaling up of tests through our partnership to accelerate COVID-19 testing, in abbreviation PAC initiative. The establishment of the African Medical Supply Platform in partnership with Strive Masiyiwa, the UN Economic Commission for Africa, and our most recent campaign, Africa Against COVID-19, aimed at protecting borders, travelers, economies, and schools as member states begin to ease the lockdown on the economy. On the epidemiological front, as of Friday, 9 October 2020, Africa has recorded over 1.5 million cases of COVID-19. Of these numbers, 1.2 million have recovered, representing 83%. And unfortunately, 37,000 Africans have died due to this infection. In terms of case distribution, we are seeing about 65% of countries reporting less than 10,000 cases. 23% of countries are reporting between 10,000 and 50,000 cases. And 11% of countries are reporting over 50,000 cases. With regards to testing, Africa CDC has facilitated over 16 million COVID testing across the continent, with a positivity rate of 9%. As part of the partnership to accelerate COVID testing in Africa, the Africa CDC is nearing a goal of facilitating 20 million tests completed by the end of October 2020. In addition to the PAC initiative, the Africa CDC is collaborating with many key stakeholders, donors, and foundations to scale up testing across the continent. Most recently, in partnership with the Bill and Melinda Gates Foundation, the Foundation for Innovative New Diagnostics, commonly called FINE, UNITAID, and the World Health Organization, Africa CDC will be partnering at a global scale to make available 120 million affordable, high-quality COVID-19 rapid tests in low and medium-income countries across the world. Diagnostics is the cornerstone of our response to the pandemic, and we will continue to work to ensure sufficient testing to help slow the spread of COVID-19. Since the onset of COVID-19 on our continent, the African Union Commission, through the Africa CDC, has taken bold and aggressive measures to respond to the pandemic, including the development of policy guidance. On the 5th of October, the African Union Commission rolled out the Africa CDC Trusted Travel Portal as part of the Africa Against COVID-19, Saving Lives, Economies and Livelihoods campaign. The app to be used by public is My COVID Pass, and I really want to recognize the extraordinary leadership of Commissioner Amira and Commissioner Amani for guiding this process since the conception. We are excited to share the phase 1 of the campaign, starting with 35 member states who have registered on the platform, and more than 2,000 laboratories have enrolled. The two core functionalities of the platform will focus on recognizing designated laboratories across the continent that conduct COVID tests, as well as the entry and exit restrictions implemented by member states. In conclusion, our work in the fight against COVID-19 would not be possible if not for the tremendous leadership and support of the AU Commission, especially His Excellency Musa Faki Mohammed and Commissioner Amira El-Fadi. Contributions from continent and global public health experts, private and public sector partnerships, bilateral cooperation, and philanthropic communities, and of course, the dedicated work of the extremely hardworking staff of the Africa CDC. I'd really like to recognize their support all through this important journey. We must continue to prevent public health measures, including the wearing of masks, washing of hands, and keeping our distance to bring this pandemic to a close. It is through communication, cooperation, coordination, and collaboration that we will achieve a stronger Africa in the fight against COVID-19. I encourage everyone to make their contribution to the COVID-19 Response Fund to play their part in safeguarding our continent. I thank you.
Good morning. The COVID-19 pandemic has disrupted the development of the African continent, and it has taken the lives of its daughters and sons. Our sincere condolences to those who have lost their loved ones in these difficult times. As the pandemic continues to threaten our lives and economies, the African Reinsurance Corporation, Africa Re, cannot stand idly by. Africa Re, a child of the African Union born in 1976, has so far successfully protected African lives and assets through insurance and reinsurance protection. We'll continue to do so. Today, our contribution to the African Union COVID-19 Response Fund is like a duty we owe to the population we pledged to develop and to protect. This is why we have set aside a budget of $3.3 million, which will be allocated by the Africa Re Foundation to a series of initiatives to support the African communities and governments in this fight against the pandemic. Thank you.
السلام عليكم. معكم أحمد سلطان من المغرب. بغيت نستغل هذه الفرصة باش نقول لكم باللي كمغربي وكأفريقي كنفتخر وكنساند هاد the African Union COVID-19 Response Fund بلا هاد initiative أنا مساندها personally. So please donate, pledge and share the African Union COVID-19 Response Fund and the entire initiative. Assalamu alaikum.
Thank you, Dr. Nkengasong. We'd also like to thank all our donors and captains of industry who've made donations and pledges. Thank you, Dr. Corneille Kerakezi, Group Managing Director, Head of the Technical Mission of Africa Re, for your continuous support. I have with me Her Excellency Amira El Fadil, Commissioner for Social Affairs at the African Union, and Mr. Paulo Gomes from the Afro Champions Initiative to share their perspective. Commissioner El Fadil, thank you for joining us today. Now, we all know the health consequences of COVID-19, but what about the socio-economic consequences?
Let me start by saying that the current epidemiological situation for the COVID-19 in the continent, Africa, reported cases exceeded 1.5 million cases. The death fatality rate is around 35,000, but also the recovery rate is very high in Africa. It's 80% plus the recovery rate, which is very, very positive. Yes. For this socioeconomic impact of COVID-19, also it is because of the measures being taken to decrease the infections in the continent, to control this pandemic. We took health measures. There is lockdowns. People were asked to stay at home. We applied social distancing as a measure, also as a protective measure. We know that our economy affected by people losing their incomes, by small businesses being shut down, by the closing of the schools, the borders. the airports, our trade affected by this, our economy is affected. There is estimations that the GDP of the continent will be less in 2020 by 7%. It will be 7% down. The economists are talking about that. Our spending will exceed our revenues, that we will go for borrowing. All these impact. Also, I can say that Africa, with the support of the partners from the United Nations and other partners, they managed to know exactly, or to predict exactly, the economic impact on the continent, the job loss that happens in the continent. And I hope that Vera will come back into this conversation, because UNECA did some studies in this area, and they know exactly the loss that will happen in the GDP. They know the estimations on the job loss that's happening in the continent, the effect on the small businesses, the SMEs, and they are recommending some solutions for Africa to take, so it can mitigate this economic impact and the economic consequences of COVID-19 on the continent. What also our leaders did on the side of the political decisions, the president of South Africa, the chair of the Union of 2020, President Ramaphosa, appointed 6 special envoys. And these 6 special envoys, they have been tasked to negotiate with the international financial institutions and with the G20 to negotiate about a moratorium and on a debt relief, on a delay of payments, because the African economies already is being stressed by this COVID-19. And listening to the report of the 6 envoys, they are also on the track of succeeding to at least minimize this economic damage happening in the continent. These 6 special envoys also, they are trying with also the international financial institutions, with our partners, the African partners, to bring more investments in the continent, to look for opportunities for creating more jobs among this crisis. And also they have been tasked to look for, to play a part actually in the resource mobilization for the fight of COVID-19, also for to bring more financial resources to the anti-COVID-19 fund. So I think being aware of your problems is always the first step for looking for solutions. Because if you are not aware that you have problems, and that these problems, it's not only in the health sector, but it's in the social sector, it's in the economic sector, it will also go to the political sector. Being aware of these challenges, being aware of these problems that's happening now, and it will continue to happen in 2021 and 2022, this clear vision, it will help us to put some solutions in place.
Mr. Paulo Gomes from the Afro Champions Initiative and a fund board member. We've been talking about the need for funds in order to get the equipment in order to support health systems. What investments would you say are needed in the short term to strengthen health systems across the continent? Because before this pandemic, that was something of great concern to governments, north, south, east, west and central. Everyone was talking about it.
Thank you, Henry. Let me also, Commissioner Amira, to thank you for this opportunity. I mean, this is a big platform for fundraising. I think we have to keep that in mind. This is a platform to appeal to people for more support and resources, because I think the most urgent part of the crisis is probably behind us, but we still have challenges going forward. But I think what will be important, and I would like to remind the member of the Response Fund, is that very quickly there was a sense of urgency in this process. And the sense of urgency has allowed us to very quickly combine the effort of the private sector and the AU and CDC. And there were 2 important elements on the CDC. We needed a platform that will prepare us to face whatever pandemic will come in the future. So it's not just about addressing the need for resources and to finance equipments, PPE and masks for the most vulnerable countries in Africa, but it's also about building a strong African institution that will get us prepared to face the next challenges. So in terms of on your question,
yes,
I mean, some experts will say that for universal health coverage, we'll need to spend each of our countries something in the region of 5% of the GDP, you know, and then you could, with that resources, address the issue of prenatal care, immunization, and also communicable disease. And what this crisis has, pandemic has brought is sense of urgency and that completely how countries need to spend the money. And so to bring the priority of health issues on the table. But those numbers, I think if a country can manage to spend close to 5% of its GDP in terms of universal health care, I think we'll be able to address the need on health. But obviously you have to go beyond that because you know we have two major trends for the next 50 years as African. The first is demography, the second one is urbanization, and all of it will require a lot of investment in terms of healthcare.
One of the things I've noticed, Paulo Gomez, in a number of countries is the difficulty in aligning the various ministries, you know, the various departments in a united fight against COVID-19. And I'm wondering if there are similar challenges in the funding because on the one hand, you want business people, governments, all kinds of actors and funds to contribute to this AU fund. But say I'm a wealthy Nigerian or Algerian or South African, I might think, well, I prefer to give the money directly to my government. What would you say to such a person, Mr. Gomez?
Yes, I think we had that situation and I think I would add what Commissioner Amira was saying. With this partnership with the private sector, very quickly, a crowdfunding platform was put in place to enable a simple African player in any country to contribute to the fund. So it was kind of very innovative through the crowdfunding. As for the issue of local, domestic versus at the multilateral level, at the Pan-African level, yes, I mean, you know how the private sector has been generous in Nigeria. You had also the same in Morocco, in Senegal. So for sure, there was a little bit of dislocation of the resources from the domestic contribution to the Pan-African one. But we were quite surprised by the pledges and also the engagement that the resource that came for Africa. But I think more important than that is that the private sector that has immediately started to engage in terms of some of the low-hanging fruit opportunity that will appear in terms of the manufacturing. So you will see, for example, in Ethiopia, some of the companies are already positioning to manufacture some drugs. There's some example in Senegal where there is a company called Innova who has received the support from the government to team up with ADS and the Abu Dhabi private sector to do the manufacturing in Senegal in a kind of a farmer park. So I think people are going beyond just contributing money, which is very important. The sense of urgency is still here to support the AU and the CDC, but there is also engagement on the ground for some very practical project in manufacturing sector that will probably help the next move, which is in terms of the vaccine. I think in some of the panel, there will be some discussion about how much money we need for the vaccine, and some numbers are, I think Commissioner Amina can provide more precision, because we will probably need billions of dollars to enable at least 30 or 20% of Africans to receive the vaccine next year. So already in terms of manufacturing of vaccine, I'm seeing some movement from the private sector, and this is a very, very good news, because this is an African continent who was not sitting like in the past and wait for the rest of the world to support. This is African has been much more proactive in terms of contribution to their own crisis, but also getting into a position where the manufacturing that at the end of the day will be the key to make sure that Africa will not be totally dependent if another pandemic comes down the road. And we know with the climate change and all the challenges with the climate change, probably there will be other pandemic in the future.
Commissioner, what is the target? What is the number of dollars that you want to get to, and how are you doing so far? Because we're here to encourage all kinds of actors to contribute to and support this fund.
The target and the projections for the financial needs made by Africa CDC is 600 million plus. This is the total amount of money needed for the whole year for the fight of COVID-19, and this is plus what is needed on the national level. That's just what is needed for us at the African Union Commission and for Africa CDC. From the first meeting of the Bureau of the Heads of State and Government, when they decided on the establishment of the fund, themselves, they made pledges. So member states, around 16 member states, and now we are getting more, they made financial pledges. These pledges they made, they divided it into two. Part of it goes directly to the fund, and part of it goes to the Africa CDC, because Africa CDC, as a technical institution, it is still under full establishment, not yet full established. We are still establishing the 5 regional centers. It needs to be strengthened as an institution. We need to recruit more staff. We need office spaces. We need to strengthen our laboratory capacity. We need to do more training and capacity building. So part of this money goes to Africa CDC. We have established 2 bank accounts for receiving the money, not only from the government, but from the government, from the private sector, from even concerned Africans. They made contributions to our accounts. We have an account in EcoBank in Kenya and another account in the Standard Bank in South Africa. We received money. I don't have the exact figure with me right now, but we received a good amount of money that's coming from member states and that's coming from private sector entities. That's coming also from our development partners, individual countries out of Africa. So we are receiving money. It is now, I think the pledges exceeded $200 million, but the one received is less than that. I believe it is 50-something% that what actually received in our accounts. But also internally within the Commission, there is a reallocation to some of the budgets of the Commission for the year of 2020. $25 million was reallocated from being for the plan of action that was approved before COVID-19. It's been shifted for the COVID-19 fight upon the approval of our member states.
Commissioner, that's a very clear vision that you've outlined for us just now. I suppose what people watching this want to know is who should donate or contribute to the fund, and how can they contribute to the fund?
Member states, governments, private sector, banks, firms, companies, individuals, philanthropists, individuals on the individual level. It's open also for our development partners. There is countries outside Africa already pledging to our fund. I can name UK, I can name Germany, Japan, China. Many countries are already pledged for this fund, and they are continuing supporting us. Some countries are giving in kind, but the majority of the donations are coming from within Africa itself. And we will continue to need more resources. We are using also this webinar as a resource mobilization event. We called Henry also on our cultural sector workers. We called for our artists in Africa, our singers, to come and to join, our musicians. We have organized a very successful concert when we were celebrating the Africa Day. I'm pleased that I have Dr. Benjamin with me here listening, that he's the one organized this concert. Musicians from the 5 regions of Africa participated. They were very enthusiastic in supporting this fund. They are our advocate also. The sports people, they were also gathering to look into how to support this fund. So we are calling upon all sectors to join on the different levels, as civil society organizations, as government also officials, to come and join the support and to put even small contributions to the fund, so that we can feel that all of us, we own this fund. It is our fund. It is for fighting this COVID-19 and to have Africa free from COVID-19 very soon.
Thank you very much, Amira El Fadil, Commissioner for Social Affairs at the African Union, and Fund Board member, Mr. Paulo Gomes, from the Afro Champions Initiative, also a Fund Board.
Your Excellencies, Captains of Industry, distinguished guests, ladies and gentlemen, it is with great pleasure that we in Afreximbank, its Board of Directors, the management and staff, join you today in support of this important initiative in the battle against COVID. As a leading Pan-African institution, the African Export-Import Bank recognizes the importance of Africa coming together to combat this pandemic, which has created significant health and socio-economic challenges across the continent and in the world. We fully support the work of the AU Joint Continental Strategy and the role of the COVID-19 Response Fund in mobilizing resources to support countries, to support institutions, support individuals, and all who are fighting from the front line in the battle against COVID. We are pleased to announce that the African Export-Import Bank has supported these various initiatives with a contribution of $1 million to the COVID-19 Response Fund of the African Union and a further $400,000 to the Africa Center for Disease Control, the CDC. The donation has already been received by the CDC and the African Response Fund. Many of you may have heard of the African Medical Supply Platform, the AMSP. That platform was developed and established by Afreximbank, working together with Mr. Strive Masiyiwa, an AU Special Envoy, the United Nations Economic Commission for Africa, UNECA, Django Africa, and all the partners to facilitate the procurement of COVID-19 related medical supplies in a cost-effective manner. The bank has already provided a grant of $500,000 to that platform. The bank is also now considering a further facility of $700,000 to support the operation of the platform. It is our pleasure, furthermore, to announce that on their own initiative, the staff of the bank have resolved to make a contribution to the AU Fund and have started the collections. As of today, contributions from Afreximbank staff have exceeded $14,000. Ladies and gentlemen, those are the recent actions taken within Afreximbank to face the challenges created by the pandemic. Similar action taken by the bank have involved various forms of financing to African corporates, to African financial institutions, to central banks, to member countries directly to assist them all face the challenges created by the pandemic. Afreximbank has disbursed over $5.4 billion under this special program known as the Pandemic Trade Impact Mitigation Facility, approved by the Board of Directors of the bank at the start of the crisis. We encourage all African banks and businesses to come together to contribute to the AU COVID-19 Response Fund and ensure that Africa collectively overcome the challenges of the COVID-19 pandemic. We are grateful to the chairman of the African Union, We are also grateful to the chairman and members of the African Union Commission and to the Africa Center for Disease Control for the great show of leadership over this crisis. It is a clear demonstration of what we as a continent can achieve when we act together. Be well and stay safe, and we thank you all again for accepting to be part of this great initiative in support of our beloved continent. Thank you very much.
My name is Dr. Wissam Manqoula, Africa CDC NSA Manager for COVID-19. On 14th of February 2020, the first confirmed cases of COVID-19 was reported in Africa, in Egypt. Up to date, we have more than 1.5 million confirmed cases reported in Africa, with more than 37,000 confirmed deaths. Since the beginning of this outbreak, it has been very clear for Africa CDC that COVID-19 anywhere is COVID-19 everywhere. So it is very important for us as a continent to jointly collaborate, coordinate, and communicate our effort together. This is why on 22nd of February, Africa CDC and African Union Commission has called for emergency ministerial meeting for health minister in Africa. During this meeting, the African health minister endorsed Africa's joint continental strategy to fight COVID-19 and also endorsed AFCOR task force as a continental mechanism to coordinate and collaborate and communicate our effort as a continent to win this battle against COVID-19. With the support from partners, from other international organizations, from member states, Africa CDC and African Union Commission were able to provide timely support to member states. With this timely support, we managed within 3 weeks to provide test kits and training for more than 44 countries in Africa. And now all the member states, they have the capacity to conduct COVID-19 testing. With your support, we started our battle against COVID-19. And with your continuous support, we'll be able to win this battle against COVID-19. So kindly join us in our fight against COVID-19.
Hello, ladies and gentlemen. I'm Stanley and I'm from Cameroon. COVID-19 has been a big mess. I can't travel, I can't tour, I can't do nothing. The communities are also suffering. But today we are proud to be here in solidarity with the African continent. We want to endorse the African Union COVID-19 Response Fund as a valuable tool for the continent to respond to the pandemic. We encourage all of you watching us today to donate, share and pledge to the AU COVID-19 Response Fund so that together Africa can stand and respond. Together, Africa responds.
Thank you, Dr. George Elombi, Executive Vice President of Afreximbank, and thank you especially to your staff who've made donations and are still contributing to the fund. And now, ladies and gentlemen, I would like to introduce Dr. Vera Songwe, Executive Secretary of the United Nations Economic Commission for Africa, to give us her perspective on the economic consequences of the pandemic and how the private sector can prevent this health crisis from becoming an even deeper economic crisis.
The pandemic has wreaked havoc on African economies. We estimate today that GDP growth will fall by to negative 5.8%, coming from 3.2%. As we all know, the sectors that are most affected are tourism, the services sectors, airlines. We also have, to some extent, agriculture, of course, the vulnerable populations. It is estimated that another 30 million more people will fall into poverty. We have a huge vulnerable population, which we believe is also going to fall into poverty. However, African governments have taken great strides and big steps to help address the pandemic. One of the things they have done is, of course, provide a $46 billion stimulus to different economies, with countries like South Africa providing 26 billion, Egypt 6 billion, Cote d'Ivoire somewhere in the order of 1.3 billion, and many others have provided stimuluses to the economies. Some have agreed that the private sector not pay taxes for 3 months, 6 months, all finding ways of providing additional liquidity to their economies. We still need more. The private sector in particular will need additional resources to be able to generate more working capital, to continue to produce, to keep businesses open, and to keep employment going. For this, we need additional capital into our banking sector. It is estimated that the private sector, working with Afri-Exim Bank, is asking for somewhere in the order of $8 billion over the last 6 months. So this should be somewhere in the order of $16 billion of private sector demand to ensure that we have a recovery and we can build forward better. These resources will need to be raised in the international community. That's why we're supporting institutions like Afri-Exim Bank to see if we can get a capital raise for them. $1 put into Afri-Exim Bank can raise another $5 billion. So the leveraging effect of that is quite important. The private sector has been resilient in 2020, but it will not be resilient in 2021 if we cannot find ways of ensuring that they have access to cheap and affordable capital in a timely way. One of the things that is clearly happening as we go through this pandemic is that we're bringing supply chains closer to the continent, which means a lot more production. We've already seen that in the area of PPEs. I think we're able to stand up over 70 companies on the continent today have shifted their businesses to the production of PPPs. These companies need working capital. These companies need some kind of blended finance to be able to afford cheap capital that would allow them to repurpose their industries. These are things that we need to set our minds to. We need to see how we can support the private sector, because as we talk about the Build Back Better, the private sector is going to be a fundamental contribution. The United Nations, as you all know, has been working very hard to see how we can continue to fund the COVID-19 pandemic and its impact on the continent. The Secretary General, as well as the Deputy Secretary General, launched a Financing for Development conference with heads of states, with ministers of finance, many from Africa and the continent, with the private sector as well from the continent, to discuss issues around, what is needed. African finance ministers have been asking for $100 billion every year for the next 3 years to see if that can help. We have launched a debt service suspension initiative, which was endorsed by the G20. That debt service suspension initiative for Africa has delivered over $4.6 billion already to over 23 countries. We're hoping that it will be extended through 2021 so that more countries can benefit from it. But some countries have not been able to have access either to development policy lending from the World Bank and the IMF or through the DSSI. That is why we're asking for an increase in special drawing rights, SDRs, of over $500 billion. We hope that about 20 billion can come to the continent. Those 20 billion should help probably stand up some of the financing for vaccines that we need, but also go to produce and procure foreign currency goods and get into our banking sector to support the private sector. So all of this is a package of goods that and requests that we're asking the international community to support us on. Finally, on the private sector side, we're working on what we call the Liquidity and Sustainability Facility, which essentially should ensure that countries that have market access can continue to have market access, honor their market obligations, but also use market resources at hopefully cheaper prices to build back better. Energy is an important part of the reconstruction period. Of course, digital technology, ICT, we've seen it, how important it is now during the crisis. It will be even more important as we try to get out. And then, of course, healthcare to ensure that as we build back, we don't neglect all these other diseases. This month is Breast Cancer Awareness Month. We at the Economic Commission for Africa are doing a lot to ensure that we don't forget the other diseases around the continent. We don't forget our women. Women are still giving birth to children. We need to make sure that those services are protected and taken care of. And finally, of course, how we take our kids back to school as we open our economies and ensure that our citizens are safe. So once again, there's a lot more to do. We hope, working in collaboration and under the leadership of the African Union, President Cyril Ramaphosa, and everybody else, the envoys, that we can find solutions for Africa as it gets out of this crisis, remembering, of course, that this is the first recession that Africa has had in 25 years. So it's going to take a lot for us to get out of it, a lot of determination. But I think so far we see that Africa's private sector has been able to come and support the process. And we hope to continue working with them as we get out of this. Given the magnitude of the crisis, of course, everybody needs to pitch in their own way. And so this is a call out to the private sector to join the African Union, to join the citizens of Africa, to contribute to the COVID-19 response fund so that we ensure that we leave no one behind as we try to respond to this crisis. So I call on the private sector, I call on philanthropy to join the COVID-19 response fund and contribute to ensuring that we can provide the PPEs, the vaccines, and everything else that's needed. Support our nurses who are on the front line to ensure that they're healthy as they take care of those who have been hit by the COVID-19 virus. Thank you.
So we at Motengil, African Motengil Group, are proud to support the COVID-19 Response Fund initiative by the African Union and led by the Board of Trustees and the Chairman of the Board of Trustees, President Aurama. We believe it's a very important initiative to pool resources and capacity in the continent to support the pandemic situation. As we know, it has affected all of us significantly, but we, as one of the economical private leaders in the continent with a presence in many countries, we believe that it is our obligation and our responsibility to support, and we recommend that all people who have the capacity to do it in the continent, who have the financial means to support, even though we are all facing struggles and difficulties on the current pandemic situation, to support so that we can have a better future for all of us and a better union in the way we approach many of the key issues in the continent. And we believe so that this initiative by the African Union is very important.
Yo, what's up guys, it's your girl Gigi Lemaine. COVID-19 has affected me in so many ways in terms of, just communication with friends, family, people I associate with, to our live performances, which is some of the biggest things as an artist. I'm not able to do as much as I used to be able to do, trying so hard on social media and digital to, keep up. And I hope that the encouragement alongside the amazing song that we've just done with a whole lot of artists across Africa has affected you in the right way. And so we're proud to be here today in solidarity with the African continent to endorse the African Union COVID-19 Response Fund as a valuable tool for the continent to respond to the pandemic. And I mean, we can encourage all of you watching here today, please guys, donate, share, pledge to the AU COVID-19 Response Fund. It's an amazing initiative. It goes out and it helps people who are less fortunate. It helps people who are struggling with a lot of things, including, just making ends meet. Remember guys, that together Africa responds all the time. So let's do the right thing. Yeah.
Hi guys, it's Wallace from Abidjan. With all that is going on in the world, I want you all to be strong. I would usually tell you to be positive, but that might not be the appropriate term in this period. Joke aside, my friend, it's time for all of us to face the virus together. We need your help. Africa needs your help. Donate to the African Union COVID-19 Response Fund to save lives. It would seem like a little thing for you, but your help can make the difference for others. We have to stay united. Africa have to stay united because no one will come and change Africa for us. Let's change Africa for a better tomorrow. God bless Africa.
Hello, I'm Dr. Herilinda Temba, a medical epidemiologist with the Africa Centers for Disease Control and Prevention. The implication of a COVID-19 socially and economically is looking grim for Africa. According to Africa CDC projections, the infection rate could rise to 3.8 million if we don't implement effective measures. And if not controlled, the COVID-19 pandemic could result into economic, social, and political crisis. We therefore call for all Africans and the world to support the African Union COVID-19 response. Kindly join us and let us fight against COVID-19.
com o objetivo de unir e reforçar o setor privado africano para uma participação mais coesa, mais sólida e sustentável para o comércio e o investimento em África.
With the aim of uniting and strengthening the African private sector for a more cohesive, more solid and sustainable participation for trade and investment in Africa, also aiming at increasing the socio-economic development of our continent, as Vice President of PAFTRAC for Southern Africa, I ask that we unite our strengths with the courage, resilience, faith and solidarity that have always characterised the African people. Together we can contribute to the COVID-19 fund to fight this pandemic of the new coronavirus that plagues our continent. Together it is possible.
Hi, my name is Sam Onyemelukwe, and I work with Trace, based here in Nigeria. You know, one of the most devastating challenges about the coronavirus on young Africans across the continent and in the diaspora is a lack of knowledge and oftentimes misconceptions about what the virus means, what their personal care and health means, and how to impact that. And on the flip side, you have the entertainment community filled with vibrant, young, energetic, and oftentimes very, very inspiring personalities. And those personalities have risen to the challenge during this period to communicate to the youth, sometimes on their own, about the need to do the basic things, washing hands, social distancing, wearing face coverings. And they've done that to speak to their youth followers, their fans, because out of a genuine love and care for them. We love to have fun, but empowering that youth and educating is a sincere responsibility that we take to heart. So we, as Trace, we thank you for the partnerships. We thank you for the opportunity to speak to the youth, and we just want to empower our people to stand up and shine. Peace.
Your Excellencies, fellow participants, and to all of Africa's citizens across the continent and in the diaspora, greetings from the One Campaign. Since February this year, when the first case of COVID-19 was reported, Africa, as the rest of the world, has had to grapple with the fight against an invisible virus. Although Africa has had far less reported cases of COVID-19 compared to other parts of the globe, we have felt the economic brunt of the pandemic the hardest. Due to the necessary lockdowns which our government had to impose, this has resulted in huge economic woes for us African citizens. Africa faces its first recession in 25 years, an impact which threatens the many years of gains against poverty on the continent. In the face of such adversity, we had to congratulate the African Union in leading the charge in a coordinated response to COVID-19 through the Africa CDC. Furthermore, I would like to congratulate Dr. John Nkengasong, Director of the Africa CDC, for winning the 2020 Global Goalkeepers Award for his role in fighting COVID-19. The One Campaign has been a great supporter of the African Union COVID-19 Response Fund. To that end, One, in collaboration with the Mandela Foundation and MTV Base, created an Africa COVID-19 song. This is done with 10 of the continent's artists from across all 5 regions. The song, which you will hear shortly, is titled Stand Together, an upbeat and inspiring message for Africa and the whole world. Indeed, nobody is safe until everybody is safe. All the proceeds from this song will go to the AU COVID Response Fund from all our digital platforms. In closing, we congratulate and support the AU's initiative that is recently launched, that is Saving Lives and Livelihoods campaign. Let us remember, we cannot beat this virus by working in our own bubbles, because no one is safe until everybody is safe. Thank you, Dr. Vera Songwe, for those great insights. Before we close this event, I would like to take this opportunity to thank, on behalf of the African Union Fund Board members, the Africa CDC and Afreximbank, everyone who has contributed to the fund so far. Thank you to Mr. Manuel Mota, CEO, Mota Angel Africa, Mr. Agostino Capaya from Grupo Opaya, our frontline workers, Trace TV, the One Campaign in Africa, all our talented artists for their kind contributions and their messages of support. Before I let you enjoy Stand Together, the solidarity anthem produced by the One Campaign and our wonderful performers, I invite you once again to visit the AU's website for more information on how to make donations. Thank you very much. Merci beaucoup. Shukran. Asante sana and midasipa.
Everything is changed nowadays. Funny how we can't even play no more. It was only yesterday when we party every day. Now it's blood on the dance floor. All because of the virus. But it can't kill the power inside us to stand together and defeat Corona.
أنا وياك البارح نهني نقول هانيا تبع things are changing لكل قلب نرد شوية نخرجوا إن شاء الله نعيشوا إن شاء الله cause nobody is safe until everybody's safe tuamini nalo litakwisha na tena tutalishinda tu tupambane hii vita tumshinde COVID-19 tuna kila sababu ya kuwajali wengine tafadhali tujilinde tuwalinde tuamue sasa.
One day my people, one day we'll be celebrating cause this plague is over. Nothing will be separating us cause nobody is safe until everybody is safe. Oh, everybody is safe. Oh.
Rain no go fall forever. Sun goes to shine, my sister. We go beat Corona if we stand together. If we stand in solidarity, we no go fit to fall down, fall down. Yeah, me I like that. Me I like you and I know you like me too. Me I love you and I know you love me too. We gonna spread the word and not divide us so. Nobody is safe until everybody is safe. Oh, me I want to be safe. Oh, eh, oh. Oh, me bush and cheese. Feels like we done lost me. We'll pick up the pieces, start over. All the tears will be all over. Can you mean it will be much closer? For now we scream and shout.
One day my people, one day we'll be celebrating cause this plague is over. Nothing will be separating us cause nobody is safe until everybody is safe. Oh, everybody is safe. One day my people, one day we'll be celebrating cause this plague is over. Nothing will be separating us. Nobody is safe until everybody is safe. Oh, everybody is safe. Oh.
J'ai placé un gros big up à tous ceux qui font le taf. Dans les hôpitaux, la tristesse sous les masques. Mister Coro nous a piqué dans la face. On a tous peur, quoi qu'on dise, quoi qu'on fasse. On va gagner, gagner, gagner. À nous la victoire, notre histoire, elle va changer. Tous les jours, les soirs, c'est la messe. Frérot, tu sais, Coro nous a tous mis dans la S.
Mothers are kings and fathers are queens. You reign in your quest for the truth and strive in your sleep. The people in your past can relate. Your victory great. I saw you on the shits in your graves. Your fathers relate. Many cries now, but they never beat the sunrise. Swinging in your fight, and we waiting for your come right. Your faith gon' heal you. Heaven gon' keep you. I'm praying that the sun never leaves you. I feel you here.
Ei, se não nos unirmos agora, tudo que construímos outrora, destruímos agora. É melhor nos munirmos agora. O futuro das crianças decidimos agora. Covid não escolhe cor, somos todos alvos. Enquanto não tivermos todos, ninguém tá salvo. A mensagem é básica, para não mudarmos o nome da Mama África para Mama Lágrima.
One day, my people, one day we'll be celebrating cause this plague is over. Nothing will be separating us cause nobody is safe until everybody is safe.
Thank you, thank you, thank you, thank you, thank you.
I'm a special envoy to President Ramaphosa and the African leadership, and I'm dealing with trying to help with supply chains. And in our case, our supply chains are mostly external. We have to bring in test kits, protective equipment, and clinical machinery for breathing assistance and so forth. And of course, because of the demand out in the big nations, it's been really difficult to secure supplies for the African continent. Really, really difficult. All the countries have mobilized money, but managing to buy the goods is the difficulty. The African countries have been quite well coordinated in knowing what to do. We have done the lockdowns, even though we are unable to create safety nets. But we've done lockdowns to try and slow down the spread in most countries. Public health will not be able to cope with this pandemic if it becomes a major crisis of the scale that we have seen in the West and in China. There's almost nothing we can do about it because we just don't have time. But it has been a massive wake-up call to say we need to carry out major investment in public health, as well as to liberalize the healthcare sector so that investment can come in. So we all need to keep an eye on this and to help Africa navigate itself through something which is not of its making and is affecting us,